We are back with Hannah Mills, nurse practitioner with Cone Health Virtual Care, and we are talking about ways you and your family can stay safe and healthy this summer. Okay, pools are officially open. I know a lot are excited, and some families might be heading to the lake or beach this summer. So talk about some of that water safety.
Okay, so one, never swim alone. Always monitor children at any time, even if you know that they're expert swimmers, because anything can happen. A lot of people need to wear the U.S. Coast Guard approved life jackets. We don't realize that some of the floaties and other devices are not actually approved devices, and they can actually inhibit children from being able to float on their back or individuals who do not know how to float. So make sure that it is a U.S. Coast Guard approved swimming device in an actual body of water. Don't swim by yourself, like we said. Make sure that you're monitoring children. Don't let them play games, or don't play games yourself holding your breath when you go underwater, because you can pass out without realizing it. And then we wouldn't know if you're just holding your breath and you're excellent at it. Stay away from the drains because they can catch you. Avoid alcohol use while you're actually swimming. And most of all, like, learn how to do CPR so that you could possibly offer help to somebody that you know or somebody that you don't know. And if you need to brush up on your skills, Sagewell, Cone Health Sagewell Family Fitness Center on Med Center in Greensboro off of Drawbridge has swim lessons for children and adults. I'm actually looking at putting my daughter in those there.
Yeah, I was gonna say, I know that they happen often, so they're really good classes to take too. Okay, so what are some of the common summer ailments, injuries that people don't think about but should, and what are your tips to prevent them?
So you definitely want to make sure that you're thinking about food poisoning. It's not something that you commonly think about, but think about how many times you go over to somebody's house or you're cooking out and food is left out because we graze, right? A lot of people just graze when you're out at a party or having a good time. So a lot of things like potato salad, meats, and things like that that are left out can actually start to grow bacteria faster because it's hotter outside. Those are things that need to be immediately refrigerated after they're cooked and they're not eaten. Otherwise, you're going to be sick on your stomach. But you can see us on your My Chart for a virtual visit if you need us for that.
You know, with I just real quick, what is the rule of thumb if it's been sitting out? Would you say an hour max? Like what would that time limit be that you need to be like, okay, I'm not eating this?
I would probably do 30 minutes to hour tops.
Yeah, that's good advice. Okay. So something else to be aware of when you're outside, my least favorite animal, which are snakes. What do you do if you're bitten by a snake? Do's, don'ts, and where to go?
Yeah, so snakes are not fun for any of us, and we do have a lot of copperheads around our area, so we all need to be aware of how to handle that situation. If you can immediately move away from the snake's territory, it's going to defend its area and it wants to eat. So stay calm as possible. They always tell you that you don't want to make your heart race anymore because you don't want to pump the venom to other parts of your body. If you can identify the snake, identify the snake. A picture would help, or if you just happen to know what the snake is, because we need to know that for your care purposes. If you can isolate the area, make sure you immobilize it. If it's a dangerous like walk and it's on the ankle, don't press on it. Remove jewelry if it's on your hand, or shoe if it's on your foot. Get to the nearest medical facility as soon as possible.
Yeah, I think that's great advice too. Okay, so while this isn't just limited to summertime, what if you're bitten by an animal that might have rabies? What should you do?
So luckily, all of our Cone Health urgent care centers can treat and offer rabies exposure follow up and vaccines. No matter what, wherever you are in the United States, you need to get to a medical care facility quickly.
Yeah, I think that's good advice too. Okay, so then when when planning for summer vacation, we might need to be prepared if someone gets sick when we're away from home. What are the available options when we're out of town, and how do you do that? What do you do?
Well, great news. If you're in North Carolina or Virginia, Cone's got you covered. We do all of our My Chart visits through the virtual or the e-visits. We can do that. If you're outside of our area, of course, go to the nearest facility that you can. If you step on a jellyfish, don't wait to be seen. If you need immediate care, go to the closest center. But hopefully you can use your My Chart and we can help take care of you during the summer.
You know, I think real quick, we've got about 30 seconds. Explain the difference between ER and urgent care. When should you go to which?
So if you have a snap, crackle, pop bone scene, you need to leave home and go to the ED. If you twisted your ankle and it's just a little bruise, but you can still walk on it, you can do an urgent care.
Very easy and simply put. We love it.